Good afternoon, David West. Let's begin the warm-up session. Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to continuously learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. Please start your OET speaking role play.
Good morning, Mihiraa. It's really nice to see you today. How have you been feeling since your last appointment?
Oh, I've been okay, but honestly, I'm still trying to understand what this diagnosis really means for me. It's been a bit overwhelming.
I completely understand, Mihiraa. Getting diagnosed with type 2 diabetes can feel like a lot to take in, and it's natural to have concerns. You're not alone in this. I'm here to guide you through the process, answer all your questions, and help you manage this condition effectively. Today, we'll go over everything step by step so that you feel more confident about handling it in your daily life. Now, just to confirm, you're here today to discuss managing your type 2 diabetes, correct?
Yes, that's right. I want to know what I should do and how I can keep this under control.
That's a great decision, Mihiraa. Understanding your condition is the first step toward staying healthy. To begin, let's talk about what type 2 diabetes is. Type 2 diabetes occurs when your body has trouble regulating blood sugar levels. This happens because either your body becomes resistant to insulin, which is the hormone that helps manage sugar levels, or your pancreas isn't producing enough insulin. When blood sugar levels remain too high for too long, it can lead to serious complications, such as nerve damage, heart disease, and kidney issues. That's why keeping your blood sugar under control is so important. Does this explanation make sense so far? Now, just to confirm, you're here today to discuss managing your type 2 diabetes, correct?
Yes, I think I understand. So, it's mainly about keeping my blood sugar levels balanced?
Exactly. Managing diabetes involves a few key components, and I'll walk you through them one by one. First, blood sugar monitoring is essential. Checking your blood sugar regularly helps you understand how your body responds to different foods, activities, and medications. Then, there's medication adherence. If your doctor has prescribed any medication, it's important to take it as directed to help regulate your blood sugar. Regular physical activity is also crucial. Even simple activities like brisk walking can improve insulin sensitivity. And of course, making healthy lifestyle choices, like eating well and managing stress, plays a big role in keeping diabetes under control.
That makes sense. But I'm a little confused about what exactly I should eat.
That's a great question, Mihiraa. A diabetic diet focuses on managing blood sugar levels through balanced meals and mindful eating. Portion control is key, as eating the right amounts helps prevent spikes in blood sugar. Start by filling half your plate with non-starchy vegetables like spinach, broccoli, or peppers, which are low in carbs and high in nutrients. A quarter of your plate should include lean proteins such as chicken, fish, tofu, or beans, which help maintain energy and keep you full. The remaining quarter can be whole grains like brown rice, quinoa, or whole wheat bread, which provide steady energy without causing rapid sugar spikes. Limit sugary drinks like soda and juice, opting for water, herbal tea, or unsweetened beverages instead. Avoid processed foods high in added sugars, unhealthy fats, and salt, as they can disrupt blood sugar control. Instead, choose whole, minimally processed foods. Snack on nuts, seeds, or fresh fruit in moderation. Eating at regular intervals and balancing carbs, proteins, and fats in each meal helps maintain stable blood sugar levels and supports overall health.
That all sounds manageable, but I do have a bit of a sweet tooth. I'm also hearing so many different things about sugar and diabetes these days. Can you help me understand what's okay and what's not?
It's completely normal to be a little confused about sugar and carbohydrates with a new diabetes diagnosis. There's a lot of information out there, and some of it can be conflicting. Mihiraa, let's talk about the difference between complex carbohydrates and simple sugars. Think of complex carbohydrates, like whole grains, vegetables, and legumes, as slow-burning fuel. They take longer to digest, which means your blood sugar rises gradually, giving you better control. Simple sugars, on the other hand, are like a quick burst of energy, found in things like sugary drinks, processed foods, and desserts. They cause your blood sugar to spike quickly, which can be harder to manage. Now, that doesn't mean you can never have anything sweet again. It's more about understanding portion sizes and making healthier choices most of the time. We can work together to find ways to incorporate some of your favorite treats into your meal plan in a balanced way. The good news is that diabetes is very manageable with the right approach. By making healthy lifestyle changes, taking your medication as prescribed, and regularly monitoring your blood sugar, you can live a full and active life. We're here to support you every step of the way. Our goal is to help you feel your best, reduce your risk of complications, and improve your overall quality of life. Mihiraa, you're not alone in this, and we'll work together to make sure you feel confident and empowered to manage your diabetes.
That's comforting to hear. I was afraid this would completely change my life in a bad way.
I completely understand, Mihiraa. It's a big adjustment, but it doesn't mean you can't enjoy life. It just means making small but meaningful changes to keep yourself healthy in the long run. Do you have any other questions or concerns?
Not at the moment, but I feel much better after this discussion. Thank you, Nurse West.
You're very welcome, Mihiraa. I'm always here to help. If you ever have any concerns, don't hesitate to reach out. Take care, and I'll see you at your next appointment.